Good morning and welcome, and I am Dr. Peter Holmes, orthopedic surgeon, and I am host of your program, Ask the Doctor. My guest this morning is Dr. Stefan Kiesz. Dr. Kiesz is a cardiovascular and peripheral interventionalist. If you have any questions about your blood vessels, you want to talk to Dr. Kiesz, two ways to reach us. Do it through the foundation at www.needfoundation.org or fax 696-9012. What excites you about your job?
You know what? I am, I guess, physicians, because I was always growing up in the house when there was a doctor. My father, my grandfather, they taught me how to treat people with dignity. I love people. I love to help. It's my passion. And medicine for me, you know, I was a musician. I was supposed to make films. I wrote poetry. You name it. I raised the cars. It's my fulfillment. If I can fix this heart, nobody else wanna touch. And this fellow or the lady, you know, goes home, or save the leg, or something that makes my day. You know?
Well, let me talk about your career. You originally you and I've had a previous program. Were behind the Iron Curtain at one point. Came over to this country, and you were one of the first few to do balloon angioplasty, were you not?
That's correct. Yes.
Explain what that is.
Well, in the early 70s, Professor Andreas Granzig, who is a cardiologist and radiologist in Switzerland, developed instead of opening the chest to do the bypass surgery, developed catheter with a balloon, so you can go to the little tube called catheter with a little puncture in your groin to the heart, and over a little while, and put this catheter with the balloon across the blockage, open up the balloon, push the blockage aside, open up the vessel, get it out, and the vessel is open, as opposed to opening the chest, putting patient on you know, machine, and do the bypasses.
Well, so let me ask you. Yeah. I mean, that you know, because we're used to it now, but when you first came here, we weren't used to it.
Well, it was huge. There was, you know, this is like what happened to me. I was now I just got out of the medical school. I was one of the youngest graduates in Warsaw, and because you know, I didn't want to belong to Communist Party, I couldn't become a cardiac surgeon. So then I read about this guy somewhere that he did this balloon procedure, so I hooked up with this technique. I was very lucky because I was a good student and so forth, to get to the National Institute of Heart. And then I had a situation when there was a young guy on the table who was getting angiography in the heart, and somebody occluded his artery. The surgeons were partying somewhere, you know, they had somebody who came from the United States or whatever, and I had this catheter, and I knew the technique, and I used this catheter to unclog the artery and save his life. Of course, my boss came the next day with a little, you know, hangover, and he told me, "Hey, dude, you messed up my catheter," but I saved the life. And Granzig loved that, and I started this technique. That's what made me to believe with the technique. So first was the balloon, then so I came to US, gave lectures, this and that. They kicked me out because I was in solidarity that they were trying to go after me in martial law. I had to stay on political asylum, so I repeat my training here.
Well, that's I want to go over that, just what that is. In other words, you know, I mean, solidarity is something I grew up with.
Yes.
You know, Lech Walesa and all this stuff that happened, and Poland's free. But you were, at a certain point, you more or less had to stay in this country and desired to.
Well, not that I desired. I was persona non grata.
I gotcha.
I wanted to bring the Professor Granzig to Warsaw, and I didn't clear this out with higher ups.
Okay.
They thought that I'm too much.
Okay, so you're here, but now once you're here with a foreign degree, you had to sort of repeat everything and go through the United States, which is sort of insulting, but you did. You did all this sort of thing, and then you were faculty over at the medical school here for 11 years. 11 years on that sort of thing. And now you have your own institute.
That's correct.
Okay. How big an institute do you have?
Well, you know, the size doesn't matter here. It's a very high tech.
Okay.
It's a new model of healthcare. This is the healthcare of 21st century, and I think this is where you can really dramatically increase patients' satisfaction and patients' quality of care, and dramatically cut the cost at the same time, which is very unpopular among the big hospital organizations, and you can only imagine, using new techniques, because I don't cut, I only puncture, and I go through the small catheters and stuff. I can recover this patient.
Well, you know, I think you brought up a very interesting point, and I'm going to diverge one more time because you keep doing that to me. But again, the outpatient centers and the specialty hospitals like you have are very cost effective.
That's correct.
Very clean, know what they're doing. You don't get interfered with. If you're doing heart and cardiovascular, you don't have a gallbladder bumping you out of the way.
Sure.
And,
much safer.
But the big hospitals, because of their inefficiency, hate you because they want our patients, like my arthroscope patients and your heart patients, to go over there and pay 3 times what they should. Isn't that a good number? Or whatever?
About, 3 or 4.
To cover for their inefficiencies. So, okay. That's another editorial, but that's what you're talking about. So you can, you're more efficient.
That's correct.
You get it done, and with
patient satisfaction is incredible. We are first in the world. Imagine this in San Antonio. There is like Julio developed this, and I developed a new first in the world model of care. When I can fix the heart and you go home in 4 hours.
Okay, we'll get back to that. We'll take a break. Okay, I want to talk about the patient who's eligible for this. My guest, Dr. Stefan Kiesz. Dr. Kiesz, cardiovascular, endovascular, peripheral vascular interventionist. If you have any questions for Stefan in the future, any of my other guests, and care to help my kids with little or no insurance, do it through the web, www.needfoundation.org, or fax 696-9012 to ask the doctor. Good morning and welcome back. I am Dr. Peter Holmes, orthopedic surgeon and host of your program, Ask the Doctor. My guest is Dr. Stefan Kiesz. Dr. Kiesz is a cardiovascular, peripheral, and endovascular interventionist. And Stefan, before we took the break, we're talking about the heart and the blood vessels. And obviously you were doing this since the early 70s, had the experience, and then on.
Early 80s.
Okay, but you saw, this guy comes up in the 70s, 80s is 90s, so 20, 30 years.
Not that old.
Okay. You're not that old. Okay, you started when you were 10 years old, though, remember? So
26.
If a patient has chest pain,
should
they bother going to the emergency room, or should they go to your place, or how does this work?
Well, you know, if this is an emergent situation, at this point you should go to emergency room, okay?
Okay.
If you have a tightness, pressure and stuff, because, you know, there are this group of patients who belong to the hospital. We all agree with it. And you have to be very selective. But there is a huge group which doesn't belong there. So I always tell the folks from the hospital, say, listen, it's going to be a win-win situation. Let's focus on patient. Let's not focus on politics. Patient is the most important. We are for the patient, not the other way around. So tightness, pressure, in the middle of the night, you have to call 911 and go there. Of course, if you know there is a big aneurysm in your aorta, some very complex stuff, you know, which is risky, these patients should be done in appropriate setting and stuff. But with new technology, if you're coming for the electively to check your heart with the catheter and stent, with our technology, you can come to the center, which looks like a four-season hotel. And I don't care whether you have money or not, because we have indigents, we have everybody coming in. This is open for everybody. And you have, your admission process takes 5 minutes. Instead of having some unpleasant rather person, you have 2 greeters. You have excellent facility when people are focused on you. You don't have just accidental, you know, agency nurse. We have the highest quality nursing staff, the technologists, people who are absolutely dedicated on you. You have absolute attention. There is no slip-ups. And then you have in this incredible technology environment, you have the highest quality procedure. You know, I was teaching stenting and doing stenting before anybody knew what the stent was, and angioplasty and all this stuff. So we are very technically adept, and only physicians who work with me who are allowed to do it has to be of highest quality.
Well, and also there is sort of such thing, I hate to call it, but elective catheterization, isn't it?
Absolutely, yeah. That's 90% of the stuff.
Right.
That's for that. You know, when you come to our center, we can take care of this and fix the heart and stuff. You go home the same day.
Hey, so do you have cardiologists working on your staff as well? Or?
Yes.
Okay.
Yes, I do have. Yes.
So yeah, I've had stress tests kind of thing. They do stress tests, and
in our institute next to it, we have a state-of-the-art facility with the newest, you know, whistles and bells. I have endovascular, neurovascular interventionalists, radiologists working with me and stuff. Unfortunately, we couldn't do the stroke center he wanted to do in San Antonio, but the hospital organization and some other groups prevented us, so he goes back to Hopkins, but
well,
we will be...
I guess what my point is that, you know, when I talk about where you can have this procedure done on an elective basis is, okay, you go in for your stress test and you flunk.
Well,
and that's the kind of thing you don't need to call 911 for.
No.
You go over and get
exactly.
cath
We
and
have
a balloon.
actually patients when we have a stress test. I read it right away. We read it right away, and he goes next door, and we fix the heart, and he goes home the same day.
And encourage it. Walk in and get out of a hospital environment where you don't get sick, like at the main hospitals. With that, we're going to take a break, okay?
That's right.
My guest is Dr. Stefan Kiesz. Dr. Kiesz, as you can gather, is a cardiovascular, peripheral, endovascular interventionist. If you have any questions for Dr. Kiesz in the future, any of my other guests, or care to help my kids with little or no insurance, which is also very important, 2 ways to reach us. Do it through the foundation, www.needfoundation.org, or fax 696-9012 to ask the doctor.